Hi, I'm Dr. Brian Thomason, and you've navigated your way here to this information based on your interest and your desire to learn more about regenerative medicine. In this short video, we'll be covering the following topics. What exactly is regenerative medicine? Cellular therapies. The breaking down of the human body, also known as degeneration. The characteristics of regenerative cells and their chemistry. Where do regenerative cells come from? What if I've been told I'm bone on bone? The exact cost of therapy. And finally, the next step to take if you're interested in furthering your exploration of this therapy. Patty, you had regenerative cell therapy. How long ago?
July 31st.
And how many months ago was that?
That's 3 months.
So about 3 months out. And today was your second follow-up. And we just looked at your knees on ultrasound. And what did we see?
We saw lots of cartilage growth.
Cartilage regrowth.
Very, very good.
Fantastic.
Yes.
And how about your daily activities? How have you improved since you had your injections?
I don't have the pain getting up, walking. I can do anything. Go exercise every day, and I'm doing great.
Fantastic. And what shape were you in before you came and saw us in the office?
It hurt.
Yeah,
I was ready to do surgery, didn't want to.
Fantastic.
So, yeah.
We appreciate you. Thank you very much.
Thank you.
All right, we're here with Cynthia. And Cynthia, you had stem cells injected into both knees?
Both knees.
Tell us your story.
Came in with being in pain from a 5 to a 9, depending on the day. Had to be on crutches, on a cane. Now I don't need anything. I'm on heels. I'm walking 10 miles a day. I dance, doing swing, ballroom, country, and I'm ready to start running.
Follow up, and we looked at post ultrasound, and what do we see different?
We saw a big growth.
In?
And I can't wait to find out what happens in 3 more months from now.
So cartilage improvement on ultrasound. Thank you very much.
Thank you.
Now I'd like to encourage you to watch the video all the way through to the end. For those of you who do, you will be offered a substantial discount on any regenerative cell therapy purchase in our clinic. Let's take a look. Regenerative medicine is a branch of medicine that seeks to facilitate the repair and the regeneration of tissue that has been damaged by disease, trauma, or congenital issues, as opposed to the traditional clinical strategy of focusing primarily on treating symptoms. Sometimes beginning in our 40s, but more often in our 50s and 60s, most all of us will encounter a level of pain or discomfort that causes us to change the way we live our life. The human body begins to break down when our youthful ability of tissue regeneration starts to decline. This is known as degeneration. Let's take a look at what degeneration looks like on film. So here we're looking at 2 x-rays of very different knee joints. Starting with the one on the left, which is healthy, you can see a nice, clear, open, and even joint space, which appears as the dark space here. Now, what you can't see on this x-ray is what exactly holds this joint space open, that which keeps the upper and the lower leg bones from touching each other. Now, although you can't see it on x-ray, it is something you've all heard of before. It is a soft type of cartilage. You actually have 2 different types of cartilage in your knee, a hard type and a soft type. So this is a soft type of cartilage known as the meniscus. In the process of degeneration, this is the first cartilage to break down slowly over time, creating an ever smaller joint space until we see something close to the knee on the right. Looking at the knee joint on the right, we see that the joint space is smaller than normal here on this side, and on this side it seems as if it's completely gone, seemingly no joint space left whatsoever. You might even conclude that this knee is what they call bone on bone, but I have to say, if you've been told that you're bone on bone, you should know that this term is widely overused. And on x-ray at least, even a radiologist can't visualize the hyaline, which is the hard cartilage, that actually lines the articulating surfaces of bone within the knee joint. So even if you've been told you're bone on bone, don't give up hope. You need at least diagnostic ultrasound, which we perform in our office, or an MRI to definitively diagnose a bone-on-bone condition. Additionally, I would say that just less than half of our successful knee patients have been told at some point in time that they were bone on bone before seeing us. Okay, there are two things I want to mention before moving on to the next slide, and one is that the process of degeneration is always accompanied by a process of inflammation. Number two, if I were to ask you to name the type of cells that were responsible for building your cartilage originally, the first time around, what would your answer be? If you guessed stem cells, you would be correct. Taking a look at the hip joint on the left, we can see fundamentally the same thing. A nice, healthy joint space here on the left, and again, what supports the space in this hip joint is a soft, fibrous cartilage, but in the hip, instead of it being called the meniscus, it's called the labrum. Looking at the x-ray on the right, we see a narrowing joint, which can only come from that soft cartilage degenerating, leaving the hard cartilage to unnaturally wear through to bone. Again, let me remind you that this process of tissue breaking down, or degeneration, is always inflammatory. Okay, now looking at comparison x-rays of the shoulder, here again we see a nice, clear, open joint space on the left, and just as in the last two examples we looked at, it is the soft cartilage around the edge of the joint that holds the joint space so nice and open. And like the hip, this soft cartilage is also called the labrum, in this case of the shoulder. Looking at the x-ray on the right, we see that this joint space has narrowed and is mostly non-existent. Okay, a little earlier I mentioned that the three joints we looked at, the knee, the hip, and the shoulder, had some things in common with each other. One being that they're all three known as encapsulated joints. And from what we experience clinically, these joints are among the best performing joints in regenerative medicine. We believe the reason for such good results has to do with the way that the joints are designed. Let's take a look. What we're looking at here is an illustration of the knee joint. And what I'm going to point out applies to all encapsulated joints, and the majority of joints within the body are encapsulated. Now at this very center of the joint, within the joint cavity, there is a lubricating fluid called synovial fluid. This fluid has a very low coefficient of friction, meaning that it's one of the most slippery substances known to man. The body, in its brilliant design, created a way to contain this fluid, keeping it inside the joint where it's needed for lubrication and a smooth-moving knee. It accomplishes this by growing what's known as a capsular ligament. It's kind of like a seal, a thick ligamentous membrane that makes fluid difficult to pass. That means when regenerative cells are placed into a knee joint or any other encapsulated joint, the regenerative cells tend not to migrate to other areas of the body. They tend to stay put inside the joint and do their work. Okay, the next x-rays that we'll look at are that of the lower back, more specifically the lumbar spine. The orientation is as such. So spinal discs are a common area of degeneration or cartilage breakdown and can cause significant pain and dysfunction. Similar to the joints we've reviewed so far, we are looking at a soft cartilage which exists between every two vertebrae. These cartilaginous discs hold the space open between each two vertebrae. And when they degenerate, the result is typically nerve root encroachment, or what you commonly hear described as a pinched nerve. Now, this can happen commonly in the lower back and the neck. Nerve roots exit the spine through little holes between the two vertebrae known as foramen, and it is the disc that holds them open. When the discs lose their height, the holes get smaller, putting pressure on the nerve exiting that disc level. When this happens in the lower back, symptoms can be sciatica, pain in the lower back, often radiating into the legs as far down as the toes, numbness, pain, and tingling. Degenerating discs in the neck can cause neck pain with numbness, pain, or tingling into the arm, hands, or fingers. When it comes to chronic joint pain, the four most common recommendations within the realm of conventional treatment are over-the-counter pain medication, non-steroidal anti-inflammatories, prescription medication, steroid injections, and surgery. Let's talk briefly about the benefits and drawbacks of each. Over-the-counter pain medications, non-steroidal anti-inflammatories. What are the benefits? Well, these are super convenient. I mean, any 12-year-old can buy these over the counter. They're anti-inflammatory, and anytime you reduce inflammation in the body, you're reducing pain. So they do work. They do provide pain relief by lowering inflammation. There are some drawbacks, however. The drawbacks are best described in this British Journal of General Practice published 2016 study. From the first day of use, all NSAIDs increase the risk of gastrointestinal bleeding, myocardial infarction, and stroke. Non-steroidal anti-inflammatory drugs increase systolic blood pressure by 5 millimeters of mercury and increase fluid retention. Non-steroidal anti-inflammatory drugs used in patients aged 65 and older more than doubles the risk of acute kidney injury within the next 30 days. Despite the well-advertised harms of NSAIDs, deaths from NSAIDs remain very high. More deaths than from traffic accidents and twice as many deaths as from asthma or cervical cancer. Non-steroidal anti-inflammatory drugs cause nearly 103 hospitalizations per year and kill more than 16,500 people per year. Next, prescription medication, often opioids. The benefits are pain relief. They can be very effective at alleviating pain. So what are the drawbacks? The drawbacks are they're not convenient. You need a doctor's prescription. Opioids are extremely addictive. Our relationship with opioids in the United States are described as the biggest drug epidemic in U.S. history, responsible for more than 130 deaths per day, leading at least tens of thousands each year to black market heroin use. Other medications have serious side effects, typically liver and kidney damage. Also, muscle relaxers contribute to the leading cause of death in people over 65 years of age, which are falls. Okay, steroid injections, benefits. Corticosteroids have a strong anti-inflammatory effect, and one injection can last weeks to months. Drawbacks. Corticosteroid injections are limited to between 2 to 3 per year. So studies show that cartilage, when it is exposed to cortisone, actually degenerates from the cortisone exposure. So you have a degenerating joint being injected with corticosteroids for a short-term anti-inflammatory pain relief effect, but furthering or quickening the degeneration by using that medication. Other side effects of corticosteroid injections are osteoporosis, elevated blood sugars, cataracts, high blood pressure, weight gain, and tendon rupture, among others. And the final recommendation, surgery. We're talking total joint replacement. Instead of me listing the benefits and the drawbacks to knee surgery, let's hear from two prominent orthopedic surgeons who have a lot to say, a lot of insight into knee surgery.
Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzo.
On today's episode, we're going to be talking about a controversial topic, the unhappy or painful total knee replacement.
This is a very hot topic because if you do have a painful or stiff or unhappy knee, you are miserable usually with this situation because you've had a knee replacement and you're just not happy.
And unfortunately, it's quite common.
Yeah, and so first off, you're not alone. If you're in this situation, you've had your knee replaced, you're not happy with it, you are not alone. There's definitely a subgroup of people who do not love their total knee replacements.
And it is not in your head. It's a very real problem that has a bunch of different causes. So number one reason that people are unhappy with their total knee or unsatisfied is probably residual pain. I would say that all of my knee replacement patients would say that they have less pain than they did when they started, but maybe not as much as they were hoping to get. So often people will not get to a 0 out of 10.
Yes, I mean, I have seen some people say it hurts more than it did before. When I've been referred some patients to give a second opinion, they've had their knee replacement done elsewhere and they come and see me and say my knee replacement still hurts and it actually hurts more than it did before.
Other reasons that people are unhappy, Paul?
Well, stiffness.
Yep.
The knee's stiff, it just doesn't move like you want it to move, doesn't bend.
Yeah, or unstable. The potential is too loose.
Feels wobbly, going up the stairs, my knee feels...
It's like Goldilocks, too tight, too loose.
Never happy.
Just right. Yeah, and last one?
So what do we say? Stiffness, a residual pain, and it's just not what you expected.
Unmet expectations. By far the number one reason cited in studies is that people's expectations were not met. So they thought it was going to be up here and they end up down low.
If someone comes in to see me and they say, I've had a total knee replacement and I'm not happy, it hurts, it's swelling, it's giving me problems, there are some things that we have to rule out. And the first thing that I want to rule out is an infection. I want to make sure that that total knee replacement is not infected.
The infection, but is the one that has potentially more serious complications than the one that's potentially correctable as well. So yes, for sure, infection is number one on my list. I'd say loosening is probably number two. So where the implant loosens from the bone.
Early.
Yep.
It just should loosen maybe 20 years from now, but then all of a sudden in 6 months it's loosened.
Yep.
Or maybe the size is wrong. Maybe the size that was put in you is too big or too small.
Yep. The patella can potentially be a source of pain or dissatisfaction, particularly if it does not track properly. If it tracks to the outside, often it will give you a sensation of instability or possibly more pain.
So Dr. Wiening just described that the patella, which is another name for the kneecap, can potentially be a source of pain or dissatisfaction, especially if it doesn't track correctly after surgery. Now, a little further in the information, you're going to see an example of an adjunct procedure that we perform in our clinic. It's called Trigenics, which restores tracking to the patella in patients with this problem. And it works for people either before or after they have surgery.
And the last one I think that comes on this list is referred pain. That's a tricky one because what we're saying is, yeah, you're feeling the pain in your knee, but the pain is coming from somewhere else, like your hip or your back.
Sure. And then just like you were talking about, the other thing that potentially is the cause of this is that you're expecting more out of your knee than it can provide.
Right, expectations.
For the first 6 or 8 weeks after your operation, you're working really, really hard, and then as time passes, you start to do less and less. Your muscles get weaker, and then often that can be a source of pain again. So I tell people their physio should be actually like brushing your teeth. Once you have your knee, I think you should do your physio every day, just like brushing your teeth. You should never, ever stop physiotherapy because you have now a knee that's made out of metal and plastic, muscles that have been compromised by an operation, so you need to do it every day. And most people won't do that.
So the recommendation is for physiotherapy daily for how long? For the rest of your life. Kudos for Dr. Wiening for disclosing this to his patients. My guess is that most doctors are not telling their knee replacement candidates about these expectations for success.
So I would probably try to talk that person out of an operation because I tell them the odds of success probably is 50-50
Like
at
flipping
best.
a coin.
Yeah, which is, I think surgery when you're going in for 50% success does not make a lot of sense to me. So I would push them certain beyond 2 years. I would want them to try to wait as long as they could, try to get as used to it as they could, exhaust non-operative treatment, and then potentially discuss surgery, but that is last resort. I see people who say, hey, I want to run a half marathon. I say, well, then you should do it with the knee that you have now because once I give you an artificial knee, you're not going to be able to do it, or you definitely should not be able to do it.
Right, so if you're watching this video and you haven't had a knee replaced yet,
Yes.
I'm glad you watched this video because you really want to make sure that your knee is miserable before you replace it. And remember, you are in charge of your own health.
See you next time.
Okay, so what is a stem cell? A stem cell is a blank cell. It's undifferentiated. It's a cell that has not yet been directed to become a specified cell type. So an example of a specific cell type would be a muscle cell, a bone cell, a cartilage cell, a nerve cell, a lung or a heart cell, and so on. Now, stem cells can be guided into becoming specific cells that can be used to regenerate and repair diseased or damaged tissues in people. Every specialized cell in your body was once a stem cell. Stem cells are our body's raw material for building and regenerating. Let's take a look at some characteristics of regenerative cells. So number one, stem cells divide. Under the right conditions in the body, stem cells will duplicate themselves. After duplication, they'll either specialize into whatever tissue the body needs for regeneration, or they'll duplicate again through a process called self-renewal. So they renew themselves over and over and over again for a certain period of time. Number two, they seek out degeneration by homing in on inflammation. If you remember, I stated earlier in the presentation that the process of degeneration is always accompanied by inflammation. The tendency of a stem cell is to migrate to the strongest inflammatory signal closest to it. Number three, stem cells are anti-inflammatory. So one of the most desired results when considering chronic pain is to reduce inflammation, because reducing inflammation simply reduces pain. We see this in the purpose of so many of the medications that are available to us today, the non-steroidal anti-inflammatories and the anti-inflammatory cortisone injections. Number 4, stem cells recruit, renew, and regenerate with new tissue. 2 other beneficial characteristics of stem cells are, 1, that they're immunomodulatory, which means they improve the immune system, and 2, they're anti-sclerotic, meaning they can reduce scar tissue. Okay, a good way to understand why we might benefit from regenerative cells as we ease our way into middle and later decades of life is to look at the phase of life known as the growth phase. Now, the growth phase starts at conception and it goes until about the mid-20s. We'll say 25 in this case. This is the phase of life where our bodies are actively growing. After the age of about 25, we physically stop growing. Now, here's partly why. In order to build a body from conception to a young adult, we're saying 25 years of age, requires the use of a certain percentage of the total stem cells that we have available to us over our lifetime. Let me ask you this. What percentage of your total available cells were used to build your body from conception to the age 25? Here are some choices. 17%, 52%, or 90%. What do you think? What's your guess? So the answer is in the area of about 90%. Now, during those 25 years, growth is not the only thing that's being provided by our stem cells. They also provide regeneration during this time. Most everyone can remember a time in their youth when they fell and scraped a knee or an elbow, sprained an ankle, or in some way injured themselves, and healed so quickly that they felt superhuman. With an abundance of regenerative stem cells, regeneration happens. Back to 90%. So it takes the vast majority of lifetime available stem cells to build a human body from 0 to the age of 25 years old. Now that leaves us with only about 10% of these regenerative cells to keep up with the wear and tear for the remainder of our lifetime. It seems that this 10% carries us into our 40s, or for some of us, if we're fortunate, into our 50s, but that's when we start to feel the lack of regeneration ability of our bodies. They start to break down. And this is one way of understanding why a person could benefit from regenerative medicine. One of the most common thoughts that crosses a person's mind who's considering regenerative medicine is, where do the cells come from? Of course, the concern being that somehow cells are coming from fetal or embryonic tissue, unborn or aborted babies. Let me assure you that within the United States, there are congressional laws preventing the harming of a fetus for this kind of use. There are obvious moral issues with this as a source. We do not, have not, and never will consider embryonic tissue as a source. And as certain as I can be, this practice is not taking place anywhere within the United States. And with that said, in today's current environment of regenerative medicine, there are really only 2 main considerations when it comes to choosing a source for tissue allografts containing mesenchymal stem cells. They're autologous, which literally means from self, and human umbilical cord tissue. If we look to our own body as a source of stem cells, we find them most concentrated in 2 places. Adipose tissue, which is another word for fat, and in our own bone marrow. And for years, this was the most common choice when it came to regenerative therapy. There are, however, some major drawbacks to using this as a source. So, if you want to isolate stem cells from fat tissue, you must first remove the fat from your body, and this requires surgery, namely liposuction. Now, I know there are some of you out there watching this who are thinking to yourselves, not only will I get the benefit of stem cells and regeneration, but I can get another 20 pounds off my belly. That's not a bad idea. I can accomplish 2 things at once. But there's another downside to this procedure, and it has to do with something we've brought up earlier, and that is inflammation. Before I explain, for the purpose of clarity, let's take a look at what liposuction actually looks like. Now, if you have a weak stomach, I'm going to invite you to look away for the next several seconds.
Welcome to the operating room. We're just about to get started. We're going to use some small incisions here to get access to the whole back area, liposuction, all of this.
So if you haven't seen a liposuction surgery before, you're probably now surprised at just how traumatic it is. In fact, this is what a person looks like post-op. Now, I think everyone would agree that this patient has a significant amount of inflammation. Earlier in the presentation, remember what we learned about the characteristics of stem cells regarding how they know where to go. Regenerative cells seek out inflammation. Okay, so let's take a scenario where a, let's say, 65-year-old female comes in for shoulder pain due to, let's say, a rotator cuff tear. She turns out to be a great candidate for regenerative therapy. She has liposuction, and while she's still on the operating table, they put the fat collected from the liposuction into a centrifuge. They spin that down, they isolate the regenerative cells, and in turn inject those cells into her rotator cuff. Let me ask you this question. Where do you guess those regenerative cells will migrate to? What area of this patient's body is most attractive to those regenerative cells? They're going to be attracted to the strongest signal of inflammation. And as I see it, the strongest inflammatory signal is coming from the damage that she just sustained from the liposuction surgery that she just had. The next drawback to choosing autologous is the decreased effectiveness of the regenerative cells due to age. So our patient, we said she was 65 years of age. How old are the few remaining regenerative cells that she has? Well, they're also 65 years old. And what we know scientifically through study is that older cells don't self-renew as many times as younger cells. They don't locate the inflammatory signal as well as younger cells. They're not nearly as potent nor effective as younger cells. As we consider cells from our bone marrow, this requires a surgical procedure known as a bone marrow aspiration. And the points regarding age and inflammation that we just covered are the drawbacks to this procedure as well. The cells that we would extract from the hip marrow are exactly as old as the patient who needs them. Too old. Okay, to sum up the autologous source from bone marrow or fat, number one, the process requires surgery, and with that comes potential complications, recovery, and pain. Number two, there's an added cost due to the surgical procedure. And number three, the cells are dependent on the age and the health of that patient, and typically by the time a person opts for regenerative therapy, they're both older and are dealing with some health issues. And number four, in many cases, these cells are not potent enough to make a substantial difference. So let's go over the benefits of using umbilical cord tissue as a source of regenerative cells. First off, this process is completely non-invasive. It doesn't harm anyone, nor does it put anyone at risk to be harmed. And because there's no potential harm to any human being, it is completely non-controversial. Number two, it's less expensive as there's no need for a surgical procedure. And these regenerative cells are safely delivered by way of intra-articular injection. Number three, and I'll quote Dr. Neil Reardon, since umbilical cord stem cells are less mature than other types of cells, the recipient's immune system does not recognize them as foreign. There is no rejection. We've treated thousands of patients with umbilical cord stem cells, and there's never been a single instance of rejection. And Dr. Neil Reardon, to my knowledge, has the most clinical experience worldwide applying regenerative cells to patients in a therapeutic capacity. Number four, umbilical cord stem cells demonstrate the best anti-inflammatory activity, immune system modulating capacity, and optimum ability to stimulate tissue regeneration. In short, umbilical cord stem cells are the safest, most viable, potent, and efficacious source of stem cells on the planet. In our need to offer the safest, most effective source of regenerative therapy, we looked at research studies, we looked at clinical data, as well as patient accounts of improvement, and we concluded clearly that the current best choice is the non-controversial human umbilical cord tissue as a source for the regenerative cells that we offer to our patients. One of the things that makes our clinic unique compared to other clinics in our area is an adjunct treatment that we offer to many of our patients who opt for regenerative cell therapy, known as trigenics. Labeled as a neurologic procedure, trigenics is non-invasive, performed the same day immediately before or immediately following a regenerative cell injection, is painless, and takes about 15 minutes. This is not a regenerative procedure, but results for those who are a candidate for this can be instant and life-changing. Let's take a look at a few before and after videos of patients who have benefited from Trigenics. Now, this is Terry. Earlier, I told you in the presentation that Terry was told by her orthopedic surgeon she was bone on bone. She's a registered nurse, and because she was told she was bone on bone, she was placed on the surgery schedule for a total knee replacement. Before this treatment that you're about to see, she was unable to pass the CPR portion of her relicensing exam for her RN license. Basically, she couldn't bend down getting on her knees to do the CPR chest compressions. Let's take a look.
Okay, go ahead and arms forward, and I want you to bend down, do a squat, and stop when you feel pain. That's as far as you can go.
I'm starting to feel pain, yeah.
Feel pain in the left, okay.
Yeah.
And stay in that position. Okay, and you can go ahead and stand. All right, so this is after the procedure of both knees. And arms straight out, and go ahead and bend down as far as you can. Fantastic, and back up.
Unbelievable. No, don't ask me to get back up. Way too much.
Fantastic. What do you think of that?
I think it's wonderful.
That's permanent.
So we typically do not charge for Trigenics procedure. When a person is found to be a candidate and opts for regenerative care, there's no additional cost for Trigenics.
Bring both your arms up above your head as far as you can. Okay, go ahead. Okay, that's as far as you can go, and that's painful. On a scale of 0 to 10, 10 being the worst, how bad does that hurt you?
That's at a 5. I don't want to hold him here.
Yeah, okay, bring it down. Okay, so we've just finished Trigenics procedures on both shoulders, and go ahead and lift both arms up as high as you can. So, Joe, what do you do for a living?
I have a very physical job.
Okay, yeah, you deliver packages, right?
Yes, I do.
All day long. That's amazing. All right.
Yes.
So what is the investment for regenerative cell therapy? Well, the cost for regenerative cells are measured per cc, and this is what 1 cc looks like. Let's say that you come to us with right knee pain, and we verify that your knee has degeneration, that you're a good candidate for this therapy. The typical recommendation would most likely be 1 cc for that knee joint. If a person had both right knee pain and left knee pain, mild or moderate degeneration of the cartilage in both knees, the typical recommendation would be 2 cc's, 1 cc in the right knee and 1 cc in the left knee. A person experiencing low back pain from a disc bulge or herniation, right knee pain, and a left shoulder problem could typically consider 3 cc's. So it's typical to expect 1 cc per affected joint that you would like treated. When we started out in our Walnut Creek clinic, we set our original price for 1 cc about $300 below the national average, which came to $4,700. 2 cc's, $7,450. 3 cc's were set at $9,700, and our original cost for 4 cc's was $11,550. So we knew that costs at this level would prohibit some people who needed this treatment from actually getting it. So in an effort to lower the cost for this therapy, we began holding educational presentations, webinars, much like the one you're watching now, and produced videos for prospective patients to view outside of our clinic before their initial visit. So by watching this video in its entirety, you've invested your time to better understand overall concepts, applications, and some of the limitations of regenerative medicine and how those might apply to you. By doing so, you'll cause your initial appointment in our clinic to be much more efficient in the following ways. Although you'll ask less questions in your initial visit, the questions that you do have will be more efficient. They'll be more refined. Next, You'll be more familiar with the choices once we offer those to you. Next, you'll be more familiar with the cost for care. And finally, you'll be better prepared to make decisions for your care once we give you recommendations. So this has allowed us to lower the cost per CC as follows. When you schedule and pay for your initial consultation within the allotted time frame after watching this video, you'll receive $1,000 off the original cost of any regenerative cell purchase in our clinic. That means 1 cc is lowered to $3,700, 2 cc's become $6,450, 3 cc's become $8,700, 4 cc's become $10,550. We also allow monthly payments at 0% interest if you're not able to pay for the full amount at the time of treatment. Other forms of payment are cash, check, and credit card. And our patients have had a 100% success rate qualifying paying from their flexible spending accounts or their health savings account. Typically, there are 2 visits required for care, an initial consultation and a second separate visit scheduled for your treatment. However, if you prefer to complete the initial consultation and treatment in the same day, in most cases this is entirely possible. At your initial consultation, we will take a comprehensive history, a physical examination, and a record review. This is where we go over any of your previous X-rays or MRI studies or ultrasound studies with you in detail. If we need further studies, we can always perform diagnostic ultrasound in order to see the condition of the cartilage, typically in the knee, the shoulder, or the hip. And the ultrasound, by the way, is included in the cost of the consultation. There is no additional cost for the ultrasound study. And of course, to determine whether or not you're a candidate for this therapy. The goals that we'd like to accomplish during the first visit are initially to understand your condition, and then to communicate that condition to you in terms that you understand. Next is to understand whether or not you're a good candidate for care. Next is to give you recommendations and then discuss realistic expectations you might receive from the therapy. Answer any and all questions that you have. And finally, to listen to how you would like to proceed. The second visit is treatment day. And again, you can schedule your initial consultation and treatment to happen on the same day if you'd like. You just have to let our office manager know that that's what you'd like to arrange. Each injection takes only about 15 minutes, is very typically painless, and there is 0 recovery time. You won't need to have anyone drive you into the office or home from your visit. You're able to drive yourself home just fine, and you should be able to resume normal activities the very next day. That was a lot of information, and I trust that this video provided clarity for most of you watching. At this point, there are some of you who realize this therapy is not for you at this time, and for others, you're ready to discover whether or not you're a candidate for this care. Either way, I strongly encourage those of you who are ready to take advantage of the discount provided by signing up for your initial consultation within the allotted time displayed on the sign-up page. Thank you very much for your time and your interest. May abundant health be yours.